Back pain isn't just common, it's a global epidemic affecting 619 million people today. By 2050, experts project 843 million cases. Why? Our spines face a perfect storm. Evolutionary compromises, industrialized sedentarism, and overlooked biomechanics. Unlike quadrupeds whose spines distribute weight horizontally, humans pay a tax for upright posture. Vertical compression forces concentrate stress on lumbar discs. Add modern habits, and we've engineered a crisis. Anatomically, the spine is a masterpiece of engineering. 26 vertebrae, 23 discs, 120 plus muscles. But its design prioritizes flexibility over durability. Quadrupeds like dogs experience near-zero disc degeneration. Humans suffer 40% disc desiccation by age 40. The culprit? Gravity plus sedentarism. Sitting flattens the lumbar lordosis, increasing disc pressure by 140% versus standing. Prolonged sitting also starves discs of nutrients. They rely on movement for diffusion since they lack direct blood supply. Hi, I'm Eric, and today I'm going to tell you how to use your body better. Enjoy watching, subscribe and like, so as not to lose your knowledge. Tech neck exemplifies modern strain. A 60-degree head tilt multiplies cervical load 6x from 12 PSIMs to 60 PSIMs, equivalent to hanging a car battery from your neck. Radiographic studies show this accelerates disc space narrowing at C5, C7. Corrective protocol. 1. Screen elevation. Monitors at eye level, 20 inches away. 2. Chin retractions. 10 reps hourly. Pull chin straight back, ears over shoulders. 3. Strengthen deep neck flexors. Supine head nods, holding 5-second isometrics. Sleep posture dictates spinal recovery. Side sleepers without inter-knee support torque the pelvis, straining lumbar facets. Stomach sleepers hyperextend the neck 45-degree ideal alignment. Back sleepers, pillow under knees to reduce lumbar pressure 25%. Side sleepers, firm pillow filling space between ear and shoulder, plus pillow between knees. Replace mattresses every 7 years. Sagging 0.75 inches increases pressure points 300%. Stress-induced back pain isn't psychosomatic, it's biochemical. Cortisol spikes trigger gamma motor neuron hyperactivity, locking multifidus muscles in hypertonia. This crushes disc spaces and compresses dorsal root ganglia. Break the cycle. 4-7-8 breathing. Inhale 4s, hold 7s, exhale 8s. Resets autonomic nervous system. Progressive relaxation. Sequentially contract, release muscle groups from toes to scalp. Exercise errors accelerate degeneration. Flexion under load, e.g. rounded back deadlifts, shears annular fibers, causing disc protrusions. Even crunches increase intradiscal pressure, 340 kPa. Safer alternatives. Bird dog. Quadruped contralateral limb extensions, stabilizes transversospinalis muscles. Palloff press, anti-rotation cable holds, builds core stiffness. Swiss ball marches, glute activation without spinal flexion. Footwear's spinal impact is grossly underestimated. Heels 2 inches increase anterior pelvic tilt by 25 deg, forcing lumbar hyperlordosis. Barefoot and minimalist shoes cause 27% greater calcaneal eversion, collapsing the kinetic chain. Optimal shoe specs. Heel 2 drop, 4 tighten mitemi. Arch support, medial wedge, if overpronating. Replace every 500 kilometer walked or 300 running miles. Custom orthotics reduce knee-hip torque by 19% in pronators. Daily microtraumas matter. Carrying a 15-low bag on one shoulder asymmetrically loads the spine, compressing facets 18% more on the weighted side. Twisting while lifting increases disc herniation risk 6x. Mitigation. Backpack rule, max 10% body weight, dual straps tightened high. Lift kinematics, hinge hips, brace core, exhale on exertion. Workstation reset, stand every 20 minutes, reduces disc creep. Nutritional deficiencies cripple spinal health. Discs are 80% water. Chronic dehydration shrinks disc height 1.5 mesoal a year. Key nutrients. Magnesium, relaxes paraspinal muscles, spinach, almonds. Vitamin K2, directs calcium to bones versus ligaments, natto, hard cheese. Collagen peptides, 15G day boosts disc proteoglycan synthesis 60% in trials. Advanced cat-cow protocol, beyond basics. 1. Thoracic emphasis, on hands, knees, circle upper back like a camel's hump. 2. Weighted mobility. Light plate on mid-back during extension. 3. Dynamic nerve flossing. Cow position plus chin tuck plus arm lift mobilizes brachial plexus. Do 2-minute flows hourly. Enhances disc nutrient exchange via mechanotransduction. Hydrotherapy strategies. Aquatic decompression. 30-minute floats reduce spinal compression forces 90%. Resistance training. Water dumbbells build rotator cuff strength without joint load. Contrast therapy. Alternating warm-cold jets, 3 min hot, 1 min cold, boosts circulation 300%. Non-swimmers. Use buoyancy belts for unweighted spine circles. Myofascial mastery. Gluteus medius. Sit on tennis ball, locate tender spot near PSS, hold 60s. QL. Release, side lying with lacrosse ball lateral to L3, L5. Psoas mobilization, supine, press knuckles. 2. Inside ACIS, flex hip 10x. Clinical insight. 92% of chronic low back pain patients have latent trigger points. Ergonomic deep dive. Monitor height, top bezel 2-3 above eye level. Keyboard slope, negative tilt, front higher than back, reduces ulnar deviation. Seated pressure mapping. Use apps like Posture Screen to detect asymmetries 15%. Invest in split keyboards plus vertical mice. Reduce thoracic rotation 70%. Neurological re-education. 1. Proprioceptive drills. Single leg stands on foam pads. Enhances core reflexive stability. 2. Gait retraining. Midfoot strike walking reduces lumbar shock 40%. 3. TENS units. Apply at 80 Hz over painful facets to disrupt pain gate signaling. Note: 12 weeks of balance training reduces fall-related fractures 65% in elders. Prehab protocol. Morning, cat-cow plus 5-min foam rolling. Mealtime, 500 ml water plus collagen supplement. Work hours, 20-min movement timer plus seated pelvic tilts. Evening, 10-min nerve glides plus magnesium glycinate. Track progress via Oswestry Disability Index every 4 weeks. Your spine's survival hinges on consistent micro-habits, not heroic interventions. Remember, discs degenerate at 1% yearly after age 30. Smart choices slow this to 0%. Subscribe for our knee biomechanics deep dive, featuring biomechanical analysis of dinosaur gait. Until then, respect your spine's evolutionary legacy. Move dynamically, hydrate relentlessly, and engineer your environment for resilience. Thanks for watching. Share your opinion about this and write which video you would like to see, subscribe and like, so as not to lose your knowledge.